Hello and welcome to Pulse Check with Archer Nursing, where nursing comes to life. In this podcast, you give us 15 minutes of your day, and we'll take one complicated nursing topic and make it easy. Ready for nursing to be fun? I'm Morgan, and today we're tackling Reye Syndrome. So as always, let's kick things off with our practice question. The nurse is caring for a client diagnosed with Reye Syndrome. The nurse understands that this illness is caused by which medication? A, ibuprofen, B, aspirin, C, acetaminophen, or D, diphenhydramine. All right, now I do want to quickly plug that if you haven't watched our first episode of the week on Kawasaki's disease, that is a good place to start because that goes over the one time in pediatrics where we really do use the medication aspirin. And following it up today, we're going to talk about why we usually don't. It's due to Reye syndrome. Now, Reye syndrome is rare, but it is serious and can be fatal if we don't recognize it quickly. The thing I want you to take away is the classic trigger. A child or teen recovering from a viral illness, so think flu, chickenpox, who is given aspirin. All right, this is the whole reason aspirin is a no-no in children. So let's go through what actually happens. I want you to think of it as a double organ hit. We've got the brain and the liver taking a hit here. First, liver. In Reye syndrome, we get something called mitochondrial dysfunction. Remember mitochondria? Back to our biology class? These are the little power plants of our cells. They give us energy, make us go, make the ATP, right? When they stop working, the liver can no longer do its job of processing toxins. One of those things it has to process is ammonia, okay? Ammonia levels are then going to climb because liver is shutting down and can't process it. Blood sugar then drops and clotting factors are reduced. These are all things the liver does for us. Liver's not working, high ammonia, low blood sugar, low clotting factors leading to a risk of bleeding. All right, that was part one of the double hit. That's liver. Now let's flash over to the brain. The brain is going to start to swell because toxins are building up that the liver can't get rid of. This leads to cerebral edema, which explains why we get neuro complications. Vomiting, confusion, lethargy, irritability, seizures. They can even go into a coma. It's going to start more subtle with like a change in level of consciousness, but it will get worse because that brain is swelling due to toxins building up. So big picture, if you've got a kiddo recovering from a viral infection, flu, chickenpox, etc., and now they're vomiting nonstop, their level of conscious changes, they start to seize, we need to act quickly. Labs are going to show things like an elevated liver enzyme, a prolonged PT, high ammonia levels, and to totally diagnose it, we need to do a liver biopsy. But we can't wait. Supportive care has to start quickly. So key takeaway, viral illness plus aspirin in a child, that is going to be a double hit to liver and then brain. That is causing Reye syndrome. So let's walk through a case study of a 9-year-old boy. He came into the ED, absolutely frantic parents. Just a week before this rushed ED visit, he had the chickenpox. It was starting to scab over. He seemed to be recovering well, but today he started vomiting over and over and over. He could not keep anything down. He was getting drowsy. He wasn't acting himself. And that is when the parents rushed him into the ED. We go through his history. We talk about medications and quickly find out he had been given aspirin for the fever when he had the chickenpox. That detail tells you right there what we need to look for. Okay, so on assessment, he's lethargic, far too sleepy for a 9-year-old kiddo. He's really not wanting to open his eyes. He's mumbling, he's confused, doesn't know where he is. That is a change in mental status. Pair that with the vomiting and alarm bells are going off. What has happened? The aspirin has damaged the liver's mitochondria, those little powerhouses. So the liver's not clearing toxins effectively. That means those toxins, like ammonia, are building up in the bloodstream. Ammonia going to the brain, major problems. We're getting cerebral edema, brain swelling, causing our neuro symptoms. He's confused, he's drowsy. And if we don't act quickly, it definitely can get worse. So what's your priority action? If you have got a child with decreasing level of consciousness like this, your first move has got to be to ensure your ABCs are in line. If they lose consciousness, they can lose their airway. This goes from 0 to 100 really quick. So get him on a monitor. We want to check that glucose because remember, the liver helps us with our glucose and it's not working so good. In this kiddo, it was 67, quite low. We need to get IV access right away because we know he's going to need meds. We need access for that. While we're getting the IV, get labs. We want ammonia levels, liver function tests, that's LFTs, electrolytes, and coagulation studies, because we know that liver is responsible for making clotting factors. And if it took a hit from those aspirin, then we might not have enough clotting factors, okay? We can see a prolonged PT, a prolonged APTT telling us he's not clotting very well. Now, we also still want to get blood cultures just in case this is sepsis. But when we hear viral illness plus aspirin, we are most worried about Reye's. Okay, we're getting the labs, we're on monitoring, we're making sure the airway's protected. Now, what treatment can we start? We want to get some glucose in there to stabilize that sugar. That's really important for the brain. We also need to get that ammonia down. That high ammonia is going to really put a lot of pressure on the brain, feed into that cerebral edema. So things we can do to kind of nudge the cerebral edema the other way. We can elevate the head of bed, limit stimulation in the room. Even a bright light or noise can worsen that. We need to strictly monitor his eyes and O's to look at fluid balance. Too much fluid will worsen that brain swelling. So we're keeping an eye on all of that. Now, we also want to be getting those ammonia levels down, okay? Liver took a hit from that aspirin, ammonia building up, that's hurting the brain. So medications such as sodium benzoate and sodium phenylacetate can help get that ammonia down. If that's not doing the trick, he might need hemodialysis. This kiddo luckily didn't. The sodium benzoate did help get that ammonia level down, all right? Now, there are some other things that this kiddo didn't need, but we could have to escalate to. And if you're catching the trend here, everything is about supporting getting rid of those toxins and reducing the brain swelling while the child heals. So this is all what we would consider supportive care. What is the source of the problem? The fact that we gave aspirin and that mucked up the liver. We have to let that clear, support the kiddo's body while they clear those toxins. Definitely don't give any more aspirin. That's, underlying to everything. But other things that we could have to do, helping get that brain swelling down, we can use diuretics to pull fluid off, and we can use something called mannitol to help reduce swelling in the brain. Another medication we didn't use in this kiddo that sometimes is used in Reye syndrome, a steroid to reduce swelling. And all of this depends on how severe the symptoms are, how bad the labs are. And the ultimate purpose is, we don't want this to progress to where we're having seizures because that brain is so swollen. So in summary, we're doing supportive care. We're stabilizing his blood sugar with glucose. We're helping to get that ammonia level down with medications like sodium benzoate. If that doesn't work, we could maybe be using hemodialysis. We're trying to reduce that swelling by elevating the head of bed, reducing stimulation, potentially giving medications like diuretics or mannitol, and maybe administering a steroid to reduce that overall inflammation and swelling in the brain. We're trying to clear out the toxins, help the liver, decrease the swelling in the brain, help the brain, and let the kiddo recover. Which brings us back, of course, to our practice question here. The key point of the episode, you're caring for a client with Reye syndrome. You understand the illness is caused by which medication? Shout it out. Tell me, what is the medication that causes Reye syndrome? It's aspirin. I'm not even reading the choices. You know it. It's aspirin. When it is given with a viral illness, it overloads the liver. The liver can't function. We damage those mitochondria, and it ends up damaging the brain. All those toxins build up, our brain swells, and it leads to our neuro symptoms. So the takeaway here is that we don't give aspirin to kiddos. The one exception is Kawasaki's disease, which if you haven't listened to our previous episode, you can go check that one out now. All right, future nurses, that is a wrap. If you found this pod helpful, I'd love to continue supporting your nursing journey through nursing school, the NCLEX, continuing ed, and beyond. Archer Nursing has you covered with on-demand video lectures, high-yield question banks, live case study reviews, and so much more. We want to help you master tough concepts and make it fun. So join us over at archerreview.com. Follow us on socials at Archer Nursing for more free nursing tips and study resources. Thanks for tuning in to Pulse Check with Archer Nursing. I'm Dr. Morgan Taylor, and I'll see you back next time.